In the weeks following your hip replacement surgery, the activities of daily living, such as dressing, bathing, toileting, and managing your home, will be a challenge. You'll meet with an occupational therapist after your surgery for instructions and tips on life at home. You can use this section of the program to help you prepare for your life after surgery and as a reminder as you recover from surgery. Remember, your hip precautions last for about 6 weeks. During this time, you must adapt many activities to avoid exceeding your hip precautions. You must keep your surgery leg straight in order to avoid bending the hip more than 90 degrees. You'll use a long reacher to manage your lower body dressing, such as pulling on pants and taking off socks. Always dress your operated leg first, as it's less flexible. You must use a sock aid to put on your socks. Make sure you put the sock all the way on the device. You can use a long-handled shoehorn to help you put your shoes on. If you have laces on your shoes, you can put elastic laces on so the shoes don't need to be tied. Your occupational therapist will talk to you about getting in and out of the shower safely. We recommend using a shower seat. If you have a walk-in shower, you can bring your walker into the shower with you. In most homes, the toilet seats are fairly low. You will need a raised toilet seat to stay within your hip precautions.
After joint replacement, care must be taken when getting in and out of bed, getting in and out of a chair, moving around in a walker, or using the stairs. The following techniques apply to either hip or knee patients. There are special techniques for bilateral joint replacement patients, and these are also described here.
Getting in and out of bed with the hip replacement. In order to get out of the bed toward the operated side on the left here, you move your operated leg to the outside of the bed. Then you move the good leg toward the operated side. Shift your shoulders diagonally to start to work your way out of the bed. Keep with that maneuver. Shift the operated leg, then the opposite leg, then the shoulders. Start to come up on your elbows and kind of square up to the edge of the bed. When you get to the edge of the bed, lean back to keep your hip from bending too far. Getting into bed with the hip replacement, you want to scoot your rear end back diagonally toward the pillow, basically dragging your legs across the bed as far as you can using your upper body strength. And you want to pull your good leg into the bed with the operated leg to follow. Someone can assist if necessary. Keep leaning back as you square up in bed and then go ahead and lie down.
Sit to stand after hip replacement, starting with your operated leg forward so you don't bend too far at your hip. Using your arms to help you push up from the chair, nose out over your toes, grabbing the walker. Stand to sit after a single hip replacement. Back up till you feel the chair on the back of your good leg. Slide your operated leg forward. Reach back for the arm of the chair. And slowly lower yourself down into the chair. Sit to stand after bilateral hip replacement. Using your arms to push up from the chair, maintaining your hip flexion precaution. Stand to sit after bilateral hip replacement. Back up till you feel the chair on the back of your legs. Reach back for the arms of the chair. And walk your feet forward as you sit down so you don't bend too far at your hips. Usually after total joint replacement surgery, we begin walking with a walker. Typically we start with a step 2 gait. You're stepping to your operated leg with your other leg. A progression from the step 2 gait is to step through using the walker, placing it slightly in front, stepping past the other foot, If you have a weight-bearing restriction, the physical therapist will instruct you how to walk with the weight-bearing recommended by your surgeon. You will need to use a crutch on the stairs if you have more than one step. Holding the crutch in one hand, use the railing on the opposite side. Leading up with your unoperated leg, going up the stairs. Coming down the stairs with the crutch in one hand, railing in the other, lead with your operated leg first, following with the unoperated leg. It doesn't matter which side the surgery is on, crutch on one side, railing on the other.